Hey, this is Dr. Andrew Young, and we're going to take some time and walk you through a typical office visit. So an office visit at a surgical office is a little bit different from an office visit with your primary care doctor or your internist. It can be a little bit more intimidating. There's a lot of information, especially if it's your first time visiting with us. There's a lot of information for us to collect. It's often a longer visit. There are many steps that need to be done. We're going to take you through these 8 steps. So your visit to the surgical office, again, is very different from your visit with your primary care doctor with whom you may have had a long-term relationship with over many, many years. This is your first visit with us, and so we have to get to know you and your health history. There's a lot of information that we have to acquire and then input into our system. So there are 8 separate steps that we're going to walk you through so you understand what's expected and also have an understanding of why this takes a long time. The typical time is about 3 hours. So we apologize in advance. It's not a short visit. There's a lot of information. There are a lot of steps. There's a lot of information for us to process and for you to process. The key to a good office starts before you actually come in. Once you make a visit with us, we will send you paperwork. Please take the time to fill out the paperwork ahead of time. It's going to save you a lot of stress. It's going to save you a lot of time rather than coming to the office and sitting in the waiting room trying to guess this information and find it on your phone. It's a lot easier for you to do this in the comfort of your own home. You're going to have to know, for example, your address of your pharmacy, the address of your primary care doctor, your medications, your doses. All that stuff is information that we need. It's also very helpful for you to gather prior imaging. Many of you will already be carrying a diagnosis of arthritis. You already know that you're a candidate for a joint replacement. If that's the case, please gather your prior imaging and your medical diagnostics so that those don't have to be repeated. Once you come into the office, there's a lot of housekeeping to do. You'll meet with the front desk. We need the photo ID and the insurance card. All that gets scanned into Epic, which is the medical record system that we use. Patient paperwork needs to be completed. If it's not completed already, there are other consents for you to sign electronically so that you can use the electronic medical record. And then we also want to gain access to whatever outside imaging and reports you've already performed. Once you move from the front office, we will then move you to the back office, and then you will work with our medical assistants. We will then go over your medical history, and very importantly, we need to go over all your medications and perform what's called medication reconciliation. We will also do an examination of your vitals, blood pressure, pulse, and weight. The next step concerns those who have not had prior recent x-rays. Some of you will have prior imaging, but many of you will not have had prior imaging. So our x-ray technician will then guide you through a series of diagnostic x-rays done in our office. We will then upload these into the electronic medical record and then use these for further diagnosis and management. So as you can see, there are so many steps. After you've met with the medical assistant and done medication reconciliation, vitals, medical history, after you've taken the x-ray, you will then move further along in the clinic, and then we will go over your history and physical by one of our advanced practice providers, physician assistant or a nurse practitioner. We will then go over your medical history, your chief complaint, physical exam, and then go over frequently asked questions. The physician assistant and I will then go over your history and exam before we start your review with me. In the office with me, then we will go over your history, your exam, your radiographs, your assessment. We'll go over your medical issues and then your treatment options. We are now coming to the end of the visit. At the end, there are typically one of 3 plans that occur. One is that a patient will be a candidate for ongoing conservative treatment rather than surgery. So even though we are the Center for Hip and Knee Replacement, many patients, by the time they see us, are not candidates for joint replacement. Alternatively, a second option is that we will require more information. we will recommend additional diagnostics to refine our treatment plan going forward. And then the third very common option is that it is clear that the patient is a candidate for surgery, and then arrangements will be made for that to happen. So again, many steps: pre-visit, check-in, workup, x-rays, history, my visit, and then check out. It's a long day, so please plan ahead. And then make sure that you don't have a number of appointments stacked in that section in the morning or the afternoon, so you won't feel rushed. Thank you, and we look forward to seeing you in the office.